It's also a good day because it's Doctors on Air Day presented by Lake Cumberland Regional Hospital. And we have calling in this morning from the hospital, Dr. Hassan Tahir. Good morning, Dr. Tahir.
Hey, good morning, Amy. Thank you.
Thank you for taking the time to call in this morning. February is a very important month because it's Heart Health Awareness Month. And Dr. Tahir, you are a cardiologist, a heart doctor at Lake Cumberland Regional Hospital. So Dr. Tahir, let's just start very basic. What is our heart and why do we need it? What does it do for us? And what do you do as a cardiologist?
My name is Dr. Hassan Tahir. I'm the interventional cardiologist at Lake Cumberland Hospital. Heart is the most vital organ in your body. It pumps the blood effectively in every organ from head to toe and supplies the blood to keep every organ alive. So you can imagine heart is the most vital organ, and that's why the most common conditions, the heart conditions, are coronary artery disease, which basically means a blockage in the heart arteries, decreasing to low blood supply to the heart. As a cardiologist, what we do is we take care of the most common cardiac conditions, and almost all of those heart conditions are life-threatening.
Mm-hmm. And what you mentioned some of the heart conditions. What do you see in patients that you are seeing that may be environmental lifestyles that we choose that can contribute to heart disease?
There are a lot of risk factors which can contribute to the blockages, which can increase the risk of heart attacks and strokes. Many of those are related to our lifestyle, which includes obesity, sedentary lifestyle, the diet. In addition, there are some other risk factors like uncontrolled diabetes, smoking, a lot of alcohol intake. These are some environmental and personal risk factors which can drastically increase the risk of coronary artery disease.
And when should people start paying attention to maybe what might be heart disease? Do you see a lot of heart disease in younger people, in elderly? What ranges of age do you see patients?
Most commonly we see in people more than 45, 50 years old, because age alone is a very strong risk factor. The more you age, the more chances the people can have blockages. So anybody who comes with a chest pain who is more than 50, they are more likely to have a heart disease just because of the age alone. But sometimes we also see and we get surprised that even in 30s, 20s, and 40s, the people can have heart blockages. Those are the patients who have really, really strong risk factors like morbid obesity, really bad cholesterol, excessive smoking, and also a very strong family history of premature coronary artery disease.
Mm-hmm.
Those are the patients we strongly, even though they are doing fine, these are what we call it risk factors modification. That should be offered by PCP and heart doctor to any patient, even if they are teenagers, because the blockages do not happen in a day. It takes years and years. So if somebody has really strong family history, smoker, really bad obesity, even in a teenager, we strongly recommend them to, risk stratify and modify that risk factor and cut it down so that they don't end up having blockages when they turn 30s and 40s. But we see a lot of people who have uncontrolled diabetes. It's not uncommon to have a heart condition in 30 and 40, especially in smokers and diabetic patients.
And Dr. Tahir, should everybody pay attention to their blood pressure? And what is a good, healthy blood pressure, and why does it matter what our blood pressure is?
Blood pressure, because it's almost more than half of the U.S. population have hypertension, which is a very strong risk factor for coronary artery disease. All of us, everybody who sees a PCP should have a blood pressure check once in a year. That's like a screening. And all those patients who are diagnosed with hypertension, they should pay strong attention to their blood pressure goals. And in fact, they should check it regularly, maybe 2 times a day at home to keep it under control. The good number, so your blood pressure has 2 numbers. The top number is called a systolic blood pressure, and the bottom number is called a diastolic blood pressure. Both are equally important. For a young patient, for even a middle-aged patient who does not have any heart disease, kidney disease, or any other significant comorbidities, the number is 140/90. That's a good number. It should be less than 140/90. We would call it hypertensive if it is more than 140/90. But there are a certain group of patients, for example, if somebody had a stroke, bad kidneys, have a heart disease, congestive heart failure, those are the patients we have a different cutoff. That we like to be more aggressive. We say the lower it is, the better it is. The cutoff for those patients is 130 by 80, so the blood pressure should be less than 130 by 80.
And we talk a lot about our foods and check the amount of salt in your foods and the amount of
Yes,
cholesterol in your foods. And does that certainly contribute to high blood pressure?
Yes. So for the blood pressure, we recommend a diet. It's called a DASH diet. It's any patient can request, and we always give it to the patients who have uncontrolled hypertension. What DASH diet is? It's a diet which is rich in fruits, vegetables, grains, and it has less or no salt at all. More fish, more vegetables is always helpful. The salt retains water and then makes your blood pressure high. So we do not like to, whatever salt you have put in your food, that's good, but you should not be adding more salt to your already cooked food.
If people of any age, Dr. Tahir, what are some signs and symptoms and body behaviors we need to pay attention to that might lead us to believe we need to go have our heart checked?
Yes. So the most common symptom for any heart attack or any coronary artery disease is the chest pain, and that's what we call atypical chest pain. That does not come from the muscle or rib. You cannot reproduce it. That happens like in the deep inside the chest. Many people call it as if there is a heaviness on their chest, somebody sitting on their chest, and sometimes it radiates to the jaw, neck, left shoulder, or left arm. That's what we call it a typical chest pain. But it's very important for our general public to know that, many of us think it's only the chest pain which is related to the heart. The answer is no. Almost 40% of the patients would not have chest pain. What they would have, we call it atypical symptoms. Those are the patients, they will have more shortness of breath, fatigue, nausea, vomiting, and only indigestion. The indigestion can only be the sign of heart attack. And these are the patients who are usually elderly, like more than 70. These are the patients who are mostly females and also diabetic. So those are the patients we stress them to have a low threshold to come to the ER, because these are the patients who come late, already have a heart attack, and they have more life-threatening events because of the delayed presentation.
Dr. Tahir, you mentioned family history can affect someone having heart disease, and there might not be any medical ability to get around that, avoiding that from happening, but especially in younger children, young children, what can we do to help them maybe not develop heart disease as they get older?
So strong family history is a risk factor. Those are the patients who are more likely to have coronary artery disease compared to normal population. So whoever has a strong family history of premature, especially the premature coronary artery disease, those are the ones we tell them to, lifestyle modification is the key, because then you can decrease the progression or even prevent it. We strongly recommend to be more physically active, exercise regularly, follow a good dietary pattern. And if they have other risk factors like modifiable, for example, they have obesity, they have high cholesterol, they smoke, then we strongly recommend to cut down on those risk factors. So when we combine lifestyle modification with those risk factors modification, they can lead a normal life, even prevent the progression of the blockages. So that is the key. And the exercise, I see a lot of patients, they consider a walking, like they say they walk 1 mile a day. That is considered as, no, it has to be brisk walking, a little more than that. You have to stress your heart and lung. You should be short of breath, sweating a little bit, and exercise should be brisk walking a little more. We love treadmill. That's a good aerobic exercise. Bicycling is a good one, and that you need to do a kind of exercise where you can feel your short of breath and you sweat, and the minimum should be 20 to 30 minutes, 3 to 5 times a week. That is a heart healthy exercise, and that's what we recommend to every patient who has a heart disease or who wants to improve cardiovascular outcomes over the long term.
Dr. Tahir, if someone believes they need to get their heart checked, it's been a while since they've had their blood pressure checked, their cholesterol looked at, can people come see you, or do they need to be referred to you? What do people need to do if they, especially this month in February, want to go get their heart checked?
They can always, if they have a PCP, they can always request their PCP to have a referral to the cardiology. But there are always some patients, they are worried about their heart. They can always call our office and schedule an appointment. So it can be either way. But if they are not having any symptoms, that's what I recommend, that go to your PCP. They do a very good job. We have really good PCPs in our town. They do a good job in screening by doing, cholesterol level, blood sugar levels. Some good PCPs, they even do a stress test. That's how we screen for the blockages. And then they send the patients to us with abnormal stress tests whenever they have any suspicion. So I think the PCP would be the best first medical contact for those patients who are worried about their heart. And if the PCP thinks that it can actually be a heart condition, they can always refer them to us.
And the PCP, Dr. Tahir, that's a primary care physician, right?
Yeah, it's a primary care physician, family physician, any one of those.
And how
even nurse practitioner in one of the offices.
Yes, and how important in general is it, heart-related or just overall health, for people to go see at least once a year their primary care physician?
Yeah, I think anybody who is more than 21 years old, that should be seen once in a year by a PCP, even though they are really doing fine, because it takes many, many years for any heart condition to show up. The blockages, any kind of condition which affects the heart does not happen in a day. Most of the time, it happens when you are a teenager. It starts when you are in a young age, and slowly gets worse to the point when you turn 50s, 60s, or 70s that you start developing symptoms. So that's why, if we can find those risk factors in a timely manner, we can modify it and prevent the progression. For example, the recommendation now is every patient, every person should be checked for cholesterol every 3 years. So it's starting from 21. So those are the things that they should have an annual blood pressure. So if you can identify those things, like maybe 5 years earlier, 10 years earlier, and you can give appropriate management and treatment, those are the patients we can actually improve life over the long run.
And Dr. Tahir, a lot of the heart conditions that you see, they can be manageable and treatable, right?
Yes, we are proud to say that almost every heart condition is treatable, from simple as stenting to really complex ones. Now we can deploy the valves. Those people who have a narrow valve or a leaky valve, it used to be all open heart surgery, but not anymore. We can go put catheters through the groin and can replace the valve. We have mechanical circulatory devices. Those are like artificial pumps. In case of life-threatening emergency or a big procedure, we can put it inside the heart cavity, and that pump takes over and pumps for you. We have LVADs, which is we call it artificial valve. Those are the patients who are waiting for the transplant. We can make them live till they get their transplant. And finally, we have really good long-term survival with the cardiac transplant. So I think for any kind of heart condition, we have almost a lot to offer, and very proud to say that all these procedures and new innovations are prolonging life.
And this month, Dr. Tahir, February would be a great month, as it is Heart Health Awareness Month, to get your heart checked, right?
Yes, that is absolutely right.
And we did post yesterday, Dr. Tahir, that you would be on the show today for Doctors on Air, and someone commented on the post that you were the kindest man someone would ever meet. So,
that's so kind. Thank you so much. Thank you. I'm blessed to be here, and I love my patients. Thank you so much.
Well, you've obviously helped a lot of people, and thank you for doing what you do.
No, thank you. It's my pleasure. Thank you.
Dr. Tahir, have a wonderful February. Thank you so much for calling in, and thank you for what you do for the community.
Thank you for having me. Thank you. Have a blessed day. Thank you.
You too. Have a great day. You too. Have a great day. You too.